I'm Dr. P C Jagadeesh, Chief Orthopedic Surgeon and Director of Robotic Surgery, Bandarghatta Road, Asra Hospitals. There is no age limit for the patient to undergo total knee replacement. Any patient who has got a severe arthritis should undergo replacement because the medicines what they take will not be a good for them because it definitely affects them the renal problem usually. So in that cases, when they undergo replacement, and I would say that the robotic surgery will give a better option to undergo. There is no age limit to undergo robotic knee replacement surgery because it all depends upon the damage to the knee part. We have seen that in sometimes it happens in a age group 60 years, 70 years, 80 years also. And due to some other reasons, the knee will be damaged in young people, say around 45 years, above that, or 50 years, or 55 years like that. So, there is no age limit for the arthritis. So, when there is an arthritis has completely set in and the conservative management by giving a medicines is not at all a solution, then they have to undergo a surgery. When they are undergoing surgery, the best option which we want to give it to the patient is a robotic knee joint replacement.